Hello, welcome back. I am about to be speaking with Dr Izquierdo, who is from IVF Life in Spain, to talk all about personalised treatment plans, what that means for IVF or any kind of fertility treatment, why it's important, the questions that you might want to consider asking, and what a personalised treatment plan looks like. So welcome to those who have come back. Apologies, there may have been some internet connections before, but hopefully he's going to be able to join and we can kick off what's going to be a very interesting chat. As I mentioned previously, we will have a stand at the Fertility Show this weekend in Olympia, London. So please do come along and say hi. If you want to get tickets with 20% off, then DM us because we do have some with a discount code, and also IVF Life are going to be there as well. So if you have any questions following this chat, they will be here to answer them. I'd love to know where people are watching from and whether you have spoken to a fertility specialist about a personalised plan, whether it's something that you have had guidance on, any questions that you have from a consultation or even starting treatment planning. Hello, good evening, welcome.
Hello, I'm guessing all the problems are solved right now.
The Wi-Fi does seem better, so welcome. It's lovely to be speaking with you today. And
Thank you.
introduce yourself, and then we can start talking about personalized treatment plans.
My name is Manuel Izquierdo. I'm a gynecologist for more than 25 years here in Madrid. And starting on 2021, I joined IVF Life Group, who is a group of clinics based mainly in Spain and Germany and UK as well. The IVF Spain Life Group is very motivated about focusing the fertility treatments, taking into account a personalized approach, thinking that not all the patients have the same needs and they are not going to be treated in the same way because they have different questions to be solved. So, what about personalized treatment? Very good concept because this personalization of the treatments is coming from cancer patients. Long ago, cancer patients have a great benefit adjusting, fitting the treatment according to the to their own situation. So we are far from this kind of patients, but recently we have been trying to guess what kind of treatment is the best treatment for a patient based in some specific studies. These personalized treatments are also known as precision treatment. Precision means we are going to the exact, or at least we are trying to go to the exact question, to the exact abnormality, to the exact problem the patient has. So maybe, please.
Testing, initial consult, and when people come in wanting to get some answers, whether they have had a consult with another specialist or they're coming in for the first time. What is at IVF Life, where do you start with personalized tests?
Many of our patients are coming having previous experiences, maybe being at any other clinics, having some other problems. So we focus in a very specific tests according to first of all, their personal history, their personal anamnesis, what kind of treatment have been performed, what kind of infertility they are showing, what is the main cause, but not forgetting about any other factors. Today we are very focused because it's very relevant to know about genetic conditions. We are offering our patients some genetic tests focusing to some carrier mutations profiles that maybe they are going to impact in the children. And we are performing karyotype, for example, to all the patients coming to the clinic, because it's no more than 0.5 of the patients having any abnormality in regular karyotype. But it's very important to know in advance, because these patients are needing extra questions to be applied. And for example, we ask many of our patients to perform sperm DNA fragmentation as well, because every day is more clear that it will impact implantation and ongoing pregnancy. Many of these questions are not, we have no medical evidence right now, but not having medical evidence doesn't mean we cannot incorporate, we cannot add this test to the as a regular basis practice. And I would like to mention as well diagnosing uterine abnormalities. Every day we are increasing our hysteroscopy procedures, looking inside the cavity, confirming that the ultrasound scan is right, and we have no fibroids affecting the cavity, no polyps, no adhesions, because sometimes everything looks fine, but in the end the cavity is not good enough for the embryo to implant. And maybe these tests are completed with our own endometrial biopsy findings. We offer most of our patients at least endometrial receptivity testing, because many patients have a wide window of implantation, but some patients are having a very diminished, a very narrow window of implantation, and we need to adjust the embryo time to be placed as much as possible. So maybe with all of these tools, we can have a clear picture about the treatment we are going to apply to every patient in a way of personalization greater than the one we are being used to have not so long ago.
For couples you may see where there is an issue with male fertility and everything looks okay on the female side, would you suggest testing such as receptivity?
Yes, we have patients having male factor, and this male factor is more focused today on questions like sperm DNA fragmentation, and we have available devices and available techniques to select the less fragmented sperm. So it increases the chances for the embryo to become a day 5 blastocyst stage embryo that could increase the chances of implantation. So if you add a good embryo and you focus on the ideal endometrium, maybe you need to know about the window of implantation. So many patients in our clinic are offered to have this what we call mock cycle. This means preparing the endometrium like if we were going to transfer the embryo, but we are going to take a biopsy at that moment to confirm not only the endometrial receptivity. We are able today to have studies looking for the bacteria inside the endometrium. There are two kinds, good bacteria and bad bacteria, aggressive bacteria. And it's very easy to be treated with antibiotics if needed, or with adding probiotics if needed. And we focus on endometrium looking for immunological factors as well. Many clinics, many colleagues are focusing in blood immunological factors. But our thinking is that the immunological factor should not be working the same inside the uterine cavity compared with the rest of the body. So this is the reason for us to focus. We are able to apply immunological maps, looking for immunological factors inside the endometrium, performing this so common endometrial biopsy as well.
Do you perform intralipids and IVIGs?
Yeah, it depends on the results of this immunological factors test. Sometimes we are advised in the same report, this patient has some imbalance in lymphocytes, interleukins, and this patient should be considered to have intralipids or immunoglobulins or corticosteroids or hydroxychloroquine pre-treatment or during the first time of the embryo to implant treatment as well.
Mm-hmm. Absolutely. And in terms of other cases that you've seen with many patients that you've helped, can you give us any examples of other personalized treatment plans?
Yes, with personalized treatment plans, we increase the physical strength of the patients. We are trying to decrease the emotional stress of the patients, and we are trying to increase the chances of pregnancy and increasing the satisfaction and in the end the trust of the patients in the procedure, in the clinic, in the doctors, in the people who is attending. So I remember a few cases because sometimes you are lost as a doctor. You are thinking, oh, this case should be very easy to be treated, but in the end we've been transferring embryos and one by one not succeeding, and these cases are very complicated, but sometimes we realize that we missed some good information, not knowing that the patient, for example, was carrying a very light alteration in the chromosome constitution. So I remember a case of a patient having repeated implantation failure, and they were very young, not thinking from the very beginning in a genetical factor. But when we performed a blood test karyotype, we discovered that the male was carrying translocation. This is a structural abnormality that is not affecting the health of this patient, but it increased the aneuploidy rate in the embryos. So we were very confused because the woman was 34 years old, and she was young enough, not having an increased risk of aneuploidy, but only knowing that the male had this translocation in the chromosomal complement, we were able to indicate, to apply a genetic test of the embryos, and we succeed in this case.
Fantastic.
Yeah, for sure. Sometimes there are cases like this, or sometimes we discover these patients having a displaced endometrial receptivity, and the usual rule is transferring 5 days later, starting progesterone for day 5 embryos. But sometimes we discover that the embryo should be 1 day later than expected. This knowledge is coming from this endometrial receptivity test. These are selected cases. Most of the patients having regular IVF treatments, personalized in a way of how to stimulate them, the dose, the kind of hormones they are going to receive. But sometimes we need to increase this personalized approach, adding some extra tests so sophisticated that for fortune in IVF Life Group, we have an in-house department looking for all of this technology, making us being able to offer the patients very soon all these tests that could increase their chances.
And for people who might be in the UK and London this weekend and wanting, a mini consult with yourself, will you be at the Fertility Show this weekend?
Yes, we will be there this weekend. Last year I attended this fertility show for the first time. For me, it was a wonderful experience getting in touch with the patients in a very different way that I was used to get in touch, and an opportunity to talk to each other with no compromise, being side by side with other colleagues coming from other clinics. So for me, was a very good experience trying to repeat, and maybe we have the opportunity to meet each other there, and we are available for you at this fertility show next weekend.
Fantastic. So this is this coming weekend, Saturday and Sunday in Olympia, London. And you have stand E24. We will also
Yeah.
stand E50. We would love to meet, our friends from the community there, meet people in person. And of course, you can go and chat to the IVF Live team and meet Dr. Izquierdo and the rest of the team. So please do come along. It's not too late to get tickets. You can DM us for 20% off your tickets. And we really look forward to meeting yourself and the rest of the team again in person.
Yeah. Thank you. We will be very delighted to attend you at the fertility show. We are very near the entrance on the right with a wonderful stand, and we will be attending you. A colleague of me is coming from Alicante Clinic, Dr. Isabel Herrera. The team of patient assistant staff is coming with us, and we will be very pleased to have you there.
Absolutely. We look forward to seeing you there and to some familiar faces as well. So please do come and say hi to us at the Ribbon Box and also the team at IVF Life. It was lovely speaking to you today. Thank you for explaining about your personalised approach. And I do say to people, get in touch with the team, head to our link in bio to find out more, not just about the show this weekend, but about contacting your team for a personalised plan, because really some of the cases you mentioned are complex, and so having those no stone left unturned is a good approach and something that people should get the best advice for. So thank you for your time today, and we really look forward to seeing you this weekend.
Thank you. See you next weekend, and have a very good evening.
Absolutely. Thanks everyone.
Thank
Bye-bye.
you. Bye bye. Ciao, ciao.